Hello. Facebook, LinkedIn, YouTube, hello. TikTok, hello. That you guys were going to let me know when it all popped up. Hey guys, Tuesday, 2 p.m. Q&A. Wow. I've never had more inquiries than this week. I really, in my team, we really had to go through a lot of perspective questions, some excellent questions. Some that I can, we'll get back to you on. But before we start, remember, as you pop on, let us know where you are. TikTok, tap. Instagram, we're ready to have some fun. So let's move in. Let's get to that first question. So I probably should have saved this one for last, but a fabulous question. What is your favorite smoothie recipe for brain health? So here we go. I gave it some thought. We're using it at home. Here you go. Half a cup of chopped fresh spinach, half a cup of chopped fresh kale, obviously all organic. 1 tablespoon of chia seeds, ground flax seeds, half a teaspoon of turmeric. That's optional. I like it. Some people may change the palate a little too much, the taste in the palate. However, if you can withstand it, it's a great option, a great choice to add in. Filtered water with some ice, half of avocado, of course, organic avocado. I want some organic, 80% or more cocoa powder. I'm a chocolate fiend, so I like that cocoa powder without question. I would use allulose and or stevia. You can use stevia, but allulose would be the number one choice. Allulose to taste. It's a rare sugar. We've talked about it before. Add that in, blend it all up, and you've got a salubrious, tasty brain recipe. By the way, just so you know, if you just popped in, let me know where you're from. Also, any questions you have, Instagram, Facebook, YouTube, LinkedIn, TikTok, tap. I'm here for you. Question number 2, how do you stay motivated to stay healthy? Wow, that is a great question. Well, the first thing is you have to want to get healthy. So your biggest asset in your life is your health. There is no lottery ticket to your health. So you've got to work on it every day. I get motivated because I realize that it's important as an individual. A mentor of mine, Dr. Steve Caglioso, once said, you can't give healthcare unless you take care of yourself first. And that really resonated with me. That stuck with me. And he was right about that. So try and exercise virtually every day. Try and watch my diet as much as I can. Sorry, friends and family. I know you think I'm the food Nazi, but I'm not the food Nazi. And yes, if you see me out eating and you're a patient, you do not have to hide your dish. I am not going to check it out, and I'm not going to judge you. Exercise, food, proper supplementation, trying to get more sleep, trying to do a better job. I'm motivated because this is my mission. You know, I always used to tell everybody I want to die at 120 of hypervitaminosis, and my mission hasn't changed. So, you know, for me to give and help you, I've got to try and take care of me. What's the most effective way to reduce inflammation? That's a great question. I mean, we had a lot of questions posed about inflammation. Inflammation means obviously to set a fire. So to reduce inflammation, I made some notes. Eat more green veggies. It makes sense. You know, eat from the color rainbow. The greater the colors, the more phytonutrients, the more diversity. Try and consume more fiber, both soluble and insoluble fiber. Plant-based, plant-forward. You know, I'm not a big carnivore diet. A lot of people are coming in with cholesterol markers, and I don't mean just total cholesterol, but aberrant lipid markers that are scaring the quality primary care physicians and cardiologists. So a little bit more plant-based, and of course, a lot less ultra-processed food. Be very conscious of the type of fat that you consume. Obviously, we want no trans fat. We want mono and polyunsaturated, somewhat of a limitation of saturated fat if we can. Reduce our omega-6. We want to up our omega-3s, reduce our omega-6. Omega-6s are full of arachidonic acid. I'm a movie buff, So everybody knows Harrison Ford played Indiana Jones. What does Harrison Ford hate? He hates reptiles like snakes. He hates Nazis. Got a big face over there. Not everybody's a reptile fan. And he hates poison, arachidonic acid, omega-6s are poison. Let's limit the consumption of that. Reduce your sugar intake. We all know that. We've heard me say that a myriad of times. Please do me a favor. Reduce your sugar intake. Limit, or if you can, avoid alcohol at all costs. Consume better water. Try and drink it out of a glass or a non-BPA type of substance. Add spices to all your meals. Spices are great. And some supplements, pro-resolving mediators. Pro-resolving mediators allow for the resolution of inflammation. Mix them with omega-3 fatty acids, boswellia, curcumin, which is the active ingredient in turmeric, ginger. We had a lot of questions, but low-level laser is a great way to reduce inflammation. And of course, make sure you have your detoxification pathways functioning well. Bifunctionally modulate the liver so your detox pathways work well. Get rid of a lot of toxins, therefore decreasing your inflammation. And of course, always look for organic type of creams for your beauty care and your healthcare products. So again, anybody who's tapping in, do me a favor. Let me know where you're from. If you have any questions, I'm happy to answer them. Another excellent question. What's your top tip for longevity? Last week, they asked me a longevity tip, and I made it water. Here's another one, exercise. There is a great study at Cooper University, and they did it on exercise. They broke it up into different groups. One group was if you did 2 times or less a week, you were considered not even exercising. 2 to 3 times a week, you were considered a casual exerciser. 4 to 5 times a week, I happen to fall under that category. You were considered a committed exerciser. And then there's one notch above where you're elite, where you're really getting high levels and you're really, interestingly, you're going after it. So they found out that if you worked out 2 days or less, it just didn't count. It didn't count. And the casual 2 to 3 days, no impact on your health. So if you say I went for a walk 3 times a week for 15 minutes, it's probably not enough now. The 4 to 5 days was virtually equivalent to health outcomes as those who were elite working out and busting their behind. So you got to get in there and exercise 4 to 5 times a week. Now, the one thing the study didn't say was it an hour? Was it 2 hours? I'm telling you, exercise 15 to 30-minute sessions 4 to 5 times a week. You're going to get the okay sign, if you will. There was another study that was interesting. So if you said, my God, I'm 55 years old, I'm male, I have never exercised in my life, or I haven't exercised for a long period of time, what do? Here was the secret sauce to this study. They found out that over a 2-year span, if you worked out for 5 to 6 hours per week, you could decrease the stiffness in your heart arteries substantially. So basically take 20 years off your stiffness. So the bottom line is you want to exercise, great longevity hack, but it's never too late to start to exercise. And one more add-on. Studies showed that if you make it to 80, if you want to make it to 100, the number one thing you need to add, a little bit of exercise. How often should I get a checkup? Wow, solid question. Well, everybody should go right now and go get a checkup because most of the patients we know don't have checkups that come in as new patients. So you do need a checkup. You need a full composite checkup. Yes, I do believe in a functional medicine checkup, one that's really looking all about personalization for you. Very comprehensive blood, leaky gut, gut barrier panel, food sensitivities, food allergies, all the different panels, possibly even a poop test. All that being said, the bottom line is you need to go get a checkup also. You want to get your blood pressure checked. You want to get palpated. You want to get it looked because you want to see your currency of your health is what is going on inside your body. And it's very hard to see what's going on inside your body from just looking outside your body at the external stuff. So get a checkup, and people should get blood every, I believe, 3 to 6 months. Hey, Ronnie Rodcliffe, how are you? He's saying hello from South Carolina. Anybody else? Let me know where you're from. So now we have the laser questions. Everybody knows that I love to use laser. I'm a big laser fan. I use a non-thermal low-level laser. Conair is my choice laser. They have 22 out of 25 FDA clearances. So here's a question. How often should we be using low-level laser therapy? So in a doctor's office, a typical starting point if someone talks about laser, and let me make a distinction with the low-level laser, please. You want non-thermal laser. Do not use a laser that generates heat. It does not have enough health promoting properties. Non-thermal lasers do. Non-thermal lasers will be a class 1 or a class 2 laser. So unfortunately, you don't feel them, but you will see the outcome after you have been exposed to the photonic energy. So typically, if you're going to start with acute condition, you're going to go to the doctor 2 to 3 times per week. You do that for 2 to 4 weeks, maybe then 1 to 2 times a week for 2 weeks, and then once a week for a period of time. If you're an athlete, you would probably want to get lasered before any kind of encounter, any kind of athletic event. In addition to that, if you have a rental where you're using a laser at home, you're not going to hurt yourself. You can laser yourself every day. So really depends on the scenario, but you're not going to hurt yourself using a non-thermal low-level laser. How do you feel that lasers work for pain relief? Well, I wrote a couple of notes. Pain lasers work by inhibiting COX and LOX pathways. So they shut down the inflammatory pathways. So they actually switch on specific health promoting switches. So if you want to have an impact on inflammation and pain, you want to utilize as your device non-thermal low-level laser. Can laser help with inflammation? Without question. It's shown, and I'm trying not to get too technical here, it's shown to upregulate or turn on interleukin 10. Interleukin 10 is it's an anti-inflammatory cytokine. So it's great. It promotes anti-inflammation. Conversely, it also flicks the switch off for pro-inflammation, meaning it shuts off interleukin 1 beta, interleukin 6, interleukin 10, TNF alpha. So if you're at the switch dial right here, it's turning on healing and turning off inflammation. So that is what I would call a big wow, because longevity is turning on the right health switches. Can you explain the benefits of low-level laser? You know, we could spend an hour talking about low-level laser. Some of the benefits are it helps with musculoskeletal injuries. It helps with brain neurodegenerative injuries, concussion. It's great for gut health. It helps me regulate, stimulate, balance vagus nerve tone. It's excellent for peripheral neuropathies. It's really shown, and maybe this is where it really escalates up to a new level, in that it helps with mitochondrial function, stimulating the different complexes in the mitochondria. And as you've heard me say before, mitochondrial dysfunction may be the bane of our existence. It's certainly one of the leading reasons in the shadows for long COVID. So what's your take on the ketogenic diet? We flew through these. I am a ketogenic diet fan, without question. I think the keto diet is one that we should use. The keto diet's been in play since the 1930s. It was made for people with epilepsy. So if you have any kind of neurodegenerative disease, any kind of brain issues, any kind of blood sugar issues, the ketogenic diet is a good choice. The real question is, and let's reel back a little bit, what is the ketogenic diet? The ketogenic diet is a diet that makes ketone bodies. It's typically ingestion of 70% of your calories coming from fat, about 20 to 25 of your calories coming from protein, and about 5% of your calories coming from carbohydrates. So it's an extraordinarily low carbohydrate diet. The premise is to make ketone bodies. Ketone bodies, and the gold medal winner of the ketone bodies is beta hydroxybutyrate. What's interesting about this ketone body is, number one, it's a signaling molecule. So it's able to send health signals into the cells, and it's also a great source of energy. For your brain, clean fuel is fat. For your brain, dirty fuel is carbohydrates. So that's a great basis. Also, studies are robust to the extent that ketogenic diet has decreased blood sugar levels, and it aids in blood sugar regulation. It's great for weight loss. It's not the only diet out there. I'm a big Mediterranean diet. I'm a big flexitarian diet. I'm big on a diet that I can personalize for you. So these were great questions. Every week, we're going to give 15 to 20 minutes answering questions. We've got already 10 to 15 for the next week. We're actually not going to be here next week. We're going to be here back in 2 weeks. We're going to the UK to lecture. So I'm not going to be, I'll be coming off a plane, and I just don't know if I can fit it in. If I can, I'll go live. If not, we'll be back in 2 weeks. Thank you very much. Feel free to ask any questions, because it doesn't matter if we're live or Memorex, I will get the answer to you. I'm Dr. Rob Silverman. Always here to help.